Morning, everyone, y muy buenos dias. I know people are slowly joining, but I wanted to get us started on time. I'm Bob Sanborn. I'm President and CEO of Children at Risk in Texas. We're happy to be partnering with the Children's Partnership out of California, Los Angeles. We're just excited about this day to be able to talk about Latinx children in our country and some of the different variables in regards to our children. I want to thank our partners for this. Jaritos, we're excited that they decided that they would be a partner of the state of Latinx children. We're also excited the Community in Acción is part of this, the Texas Family Leadership Council, and of course, Children at Risk and the Children's Partnership. We want to thank all of you for your sponsorship and for your partnership as we do this special summit. We hope this becomes an annual event. We'll look forward to your feedback to hear how we're doing. And before we bring out Gabriella, who's our MC, wanted to give you guys sort of set the table, if you will, in terms of what's happening with Latinx citizens in our country, the population of Latinx in our country. And the team at Children at Risk put together a number of pieces of information that we're going to go through. I'm only going to pick out one or two out of these, but I think first off, 52% of the Latinx population in our country is under the age of 30. And if we look at states like California, Texas, Arizona, what we see is that those over the age of 60 and 70, that's where the residents are white. If you go under the age of 30, the great majority are Latinx. So we see this change happening. What's important is this is the future face of our country. Let's go to the next slide. This was an interesting piece of data that our team put together, that if you broke this down by Latinos and what type of Latinos, where the origin of these Latinos. So you see in the United States overall, close to 66% Mexican, Colombian becomes another big part of this. Puerto Rican is the next. But as you go down the line, you see where the divide is. In Texas and California, you see overwhelmingly Mexican American. I grew up in Puerto Rico, and back when I was a kid, people would go to New York, and that's where you still see this very large population of Puerto Ricans in New York. Puerto Ricans also in Florida, Cubans also in Florida. But this gives you this idea of that we're not talking one big group of Latinos. It's a very different group of Latinos, something in our population we talk about a lot. Let's go to the next slide. This is an interesting, we wanted to look at citizens and non-citizenship to show you that, and when we talk about the Latinx population and Latinx families, 95% citizens. However, when you break that down into family relationships, you still see a lot of mixed status. So that 5% is very wide ranging. Next slide. When we look at language, 70% of Latinos age 5 speak English proficiently. This is a big deal. But however, in many states, and this is especially true outside of California, Texas, Arizona, there's a real shortage of bilingual and Spanish-speaking health professionals and professionals overall. Next slide. Let's take a little bit of a look at health and the impact of COVID-19 on Latinx families. What we see is that 2 to 3 times higher in the Latinx community, for varying reasons, but it's something that we just need to be aware of. As always, we've seen that COVID has impacted those in the community that least need this, right? And the Latinx community has been heavily impacted by COVID-19. Next slide. One of the interesting things that we found is this third point. The bilingual patients are evaluated differently for mental health needs when evaluated in English versus Spanish. And in the medical community, there's always been this idea that the translation has never really been very good. And so we're finding this is especially true around mental health needs. And so one of the things that we're really going to have to look at and delve deeper into is this idea around bilingual patients and mental health needs. Already in our country, we don't spend enough enough funding, we don't fund enough, we don't spend enough energy in regards to mental health. And this becomes especially true when we're evaluated differently because we're a bilingual patient. Let's go to the next slide. 25% of school children across the country, Latino. We know that in Texas, as an example, 54% of the school children are Latino. Nearly half of current US Latinx students are the first to go to college. And then this is, I've been in a series of meetings in the last couple of weeks. We're talking about DACA, and 65,000 DACA recipients graduate from high school each year. 45% of DACA recipients are currently enrolled in school or college. And we make a big investment in this country in educating dreamers. And yet, we make this investment and the payoff isn't there because we have failed to make sure that these youngsters and these young adults can grow up and get good work because we have failed to pass a real DREAM Act. So let's go to the next slide. Let's talk a little bit about economic justice. 30% of children live in poverty, but about 47% of Latinx households, 30% of our children live in poverty, but that 20% compared to 13% of all Americans and 30% of the children. But the other thing is about 47% of Latinx households own their own homes. So there's a real push there. And if we were to separate the US Latinx market from, for its own country, 8th largest economy in the world, which we thought was quite interesting. And Latinx individuals make up 65% of the workforce across sectors that were deemed essential. And 91% of DACA recipients are currently employed. Let's go to the next slide. I'm ready for the MC. Gabriella Barbosa is here. She's the Managing Director of Policy for the Children's Partnership. Gabriella, how's the weather in LA this morning, by the way?
Very sunny, very warm.
Yeah. Well, we're having a cold snap in Houston. It's 73 degrees. That's very cold for us this time of year. So very good. All right, Gabriella, I'm going to turn it over to you for the day, and let's have a good one.
Thank you so much, Dr. Sanborn. Really appreciate it. Hi, everyone. Again, my name is Gabriella Barbosa. I'm the Managing Director of Policy at the Children's Partnership. We are a California-based child advocacy organization where we promote and advocate for policies that support the health and well-being of children from historically marginalized communities. It's a pleasure to be here today as your MC. We have a really exciting program for you all, bringing together speakers whose work in California, Utah, and Texas is supporting and improving the lives of Latinx children in health, education, and economic development. Through these panels, we hope to shed light on their important work and the opportunities and issues facing Latinx children and youth in our country. If any questions come up for you as our panelists speak, please do feel free to put those questions in the Q&A box so I can lift them up as we move through our panels. I'll also introduce each one of our panelists before they begin speaking, but please feel free to check out their full bios in the packet of materials that will be sent out at the conclusion of today's webinar. All right, so for our day today, we are kicking off our panels with a presentation from Ramon and Christian Cardenas of Los Dos. So if they can please turn on their videos as I introduce them. Los Dos is the husband and wife duo of Frontera graphic artists Ramon and Christian Cardenas. Ramon is a Filipino-American visual artist and co-founder of Maintain, a multimedia artist network formed to curate cultural events in the El Paso region. Christian is a mixed media artist from Chihuahua, Mexico. The artists create public art installations as well as gallery work to form a dialogue between the cities and their people. Their work has been featured by Remezcla, PBS, Vice, and the Washington Post. Okay, Ramon and Christian, I'll hand it over to you for your presentation.
Hi, good morning, everyone. So it's going to be mainly me talking with you today because Ray has to be with the baby. So we're going to have to do this without him. But any questions that you have, you can submit and we'll try as best as possible to have both of us have a say. So I guess to start off, I'm going to talk a little bit about our work. We've been working together since 2009, so a little bit over 10 years. I was born in Ciudad Juárez. My family migrated from Puebla, and I grew up in Ciudad Juárez, which was kind of bittersweet. You know, you have your family, like the nucleus of your family with you, but then you're away from a very important part of your family as well, like your tias, tios, your grandma. And I think that's something that Ray can also relate to. And as well, just dealing with being a woman or a little girl growing up in Ciudad Juárez. You know, and dealing with all the violence and kind of stress of dealing with like extreme poverty and border life, because the U.S. is like really just a few steps away from us, and especially in my neighborhood, you could see an amusement park that was right across the border here in El Paso, and it's just kind of like that, you know, anxiety of trying to have a better life of what you experience day to day, and yet having, you know, Juarez be such a necessity for the U.S. as well as a border town. So, you know, eventually my family had to find a way to come to the U.S. and work and kind of try to provide a different reality for me and my sister. And they did it through my dad's work. I ended up having to do like a student visa. And so the process also like very nerve-wracking and very long. And I was left in a situation where I had to live in Juarez by myself, which was very dangerous. You know, I went through a lot of things that kind of eventually has informed my work and the work we do with Los Dos. So it's kind of, art has always been a way for me to deal with those conflicting realities. Like first the really nurturing environment that my parents built at home, that my mom kind of always kept our you know, our culture alive within our family, through cooking, through traditions, through different things that you know, now I value a lot more. Then it was just something normal to me, but you know, now I see that it was just her trying to keep us rooted and among the chaos of Ciudad Juárez. My sister and I always say that we survived Ciudad Juárez. For Ray, I think he grew up here in the US. So when we spend time in Juárez, since we've met, he always talks about having Juárez be something similar to the Philippines, something that he can relate to home, kind of that the same environment, even some of the same traditions that also kind of find a way into our work, and that's where the dynamic of Los Dos starts happening within these backgrounds. So you're seeing a little bit of our work, some of the murals that we have downtown El Paso. We started making stickers and kind of doing them. We saw them as collaboration with the urban space. We have many influences, but some of them are signs and hand-painted images that we see on the streets that you find all over the world, really, but that happen at the hands of like local artesanos or you know, people that are not necessarily considered artists, but yet are contributing to the sorry, local landscape of you know, commercial downtown areas, etc. So kind of all of our work kind of has that feel that wants to communicate, as well as you know, a poster or a sign that's inviting you to eat like kind of pozole inside, or burritos, or selling you you know, some type of local food. And so kind of finding refuge in this exercise of valuing our surroundings, and even though they happen in a place of struggle and being, yeah, just having a different reality from, you know, what people envision as a border town. So we take, again, influences from all these spaces, neon signs, posters that advertise lucha matches, and then kind of give them our own interpretation or dialogue or narrative. And so this one in particular makes emphasis on like social justice for women, you know, femme folks. So I think it's us trying to use a language that it's kind of inviting, that's something that's familiar more than anything, and communicate different things with it, with materials that might also be a little bit more inviting than, say, having a sculpture made out of stone or things like that. So we're interpreting things and materials that are common to everyday people, and kind of mostly sharing a message of social justice or migration, things that we are familiar with. Again, just having different types of approaches to art. And I was asked to talk about a little bit about influences, which is something I would like to mention real quick. I don't know if we still have time, how we're doing.
You're doing great. You still have time.
Oh, okay, great. So I have time for, we wanted to kind of mention, well, for me, definitely Frida Kahlo, even though it might be something, you know, that's expected, but she really, her work really did have an influence on me as a child. Just to, I saw the power of images, the power of, that they have to communicate, to tell a narrative and make you even feel maybe what the artist was feeling or intending with the message. So that kind of idea that art is also like a document, a way for you to communicate, was definitely something that I learned from looking at her work. My mom would take me to bookstores, and I would gravitate towards art books, and just really, you know, let myself be amazed by what these artists were doing with it, first images, and then of course I got exposed to sculpture, performance, and different types of art making that have influenced my work. But Also the work of Tina Modotti, Kate Colwitz, just women who were documenting the state of working class people. The work of Graciela Iturbide, Swoon, an artist that's working right now, and just to see, I remember I saw a documentary and she was featured in it, and you could see her like walking down the street with her materials and looking for a place to weed paste, and just that, seeing that was empowering as a woman and as someone who desperately needed a way to channel everything that I had been through art making, or because for me art making empowers me. It gives me strength to kind of tell these stories, and with something I make with my own hands. So just to see Swoon in that way was definitely inspiring, and to think you need to take on the streets. And then when I met Ray, it was a little bit more like we both had input, and we both had something to contribute to the idea of doing art on the streets, and that's how kind of we complement each other. Because Ray would see my illustrations and say, well, this would be good in a big format. Oh, I'm seeing questions that I haven't. Would you say that living in Juarez under the environment? Oh yeah, I actually have it written down here, and it says, I developed anxiety and depression due to the stressful environment, especially as a young woman, as a Juarense. And I faced and saw others face on a daily basis, the things that I saw, would definitely had an effect on me emotionally, that I channeled through art making. Eventually that was my way of dealing with it.
Christian, if I can go ahead and ask you a couple other questions, if you don't mind, before we close out.
I know it's
no problem. And one of them is actually related to the other question in the chat about the use of the X in the term Latinx. We would love to know more about your use of X in los dos, and why you choose to do that, and any history you can share about the use of X.
Yeah, well, I see it mainly as something that's being used in the US, that's more fluent for English speakers. As a Latina, I understand that it's harder to just say and pronounce, and so there are other options being developed for or thought about in response to gender fluidity by Spanish speakers, which is from Latine, adding the E. So I think, for example, us using los dos, it's mainly we're working out of the US right now. So it's something that, people here would understand. And also because a lot of people just kept thinking it was two males working. And, even now that we have this way of writing our name, would people just like keep referring to me as a male. So it's kind of like also a very visual thing, to show that almost Xing out of the gender vowel, but I don't see it something as that has to be demanding for people to identify, because of this reason, to not impose something that it's more, it's easier to speak for English speakers than a whole group of Spanish speakers as well. So that's more or less the reasons that we have used this abbreviation, and yeah.
We are very similar as an organization. We use the term Latinx too, and we also do it to be more inclusive of gender identities and also to not really center men in our work. So thank you for sharing that. A couple
Thank
other
you.
questions I have for you as well. How do you capture your identity through the art that you produce?
So I think by elevating things like saying street food, working class people that would sell you the street food, or people that you just see on a daily basis that wouldn't necessarily be uh, thought of as subject matter for art making.
And can you talk a little bit more about how the border impacted your identity and what it means to be Latinx?
Well, it definitely took a while, but just to really, even to myself, say the reason that you kind of have a different reality from growing up like my primos in Puebla, or somebody that grew up at the border. It's because it is different. We're definitely influenced a lot by the US, a lot more than that central Mexico. So we have this is very notable. I mean, for example, the Pachuco style, the Cholo culture, all these are things that are part of our identity as border people, but that it differs from what we experience in central Mexico or in different countries. But and I guess just I've learned to live with the reality that I'm kind of both, because it also means that you don't have to leave behind what you are, you're where you come from, because a lot of us here at the border come from different places, especially Mexico, from Veracruz, just different states. So that you can kind of exist in these both spaces, but that the border definitely is unique and a mixture of two cultures or more. And so, yeah, that I think that's how it's come to show up in our work as well.
You also talked a little bit earlier about how art has really been a way for you to deal with conflicting realities and hardship, which I thought was a really beautiful way to describe how art has influenced you. I'm wondering if you can speak a little bit more to how art has helped your community and you personally deal with the pandemic and recover from it.
Well, it's been hard because a lot of things have had to change, not being able to meet with folks, and has made it, even though like artists, we tend to be a little bit of introverts and kind of, like our own space to produce, and we still definitely need from being with other people. And so I think just a lot of stuff has happened more online, but definitely a lot of our projects have been postponed or canceled, and we've just really tried to keep up with stuff like online, just sharing stuff that we do or like process, but even just keeping the inspiration, there has been something a little bit more of a struggle than it usually is for us. But I think now we're starting to see a lot of people, like for example, we did a poster that we put up for a free download. So a different way of communicating with our audience and making our work accessible using technology and things we have available to connect with other people and social causes, social justice causes. So yeah, I think, you know, it's pretty basic what has had to happen, just the use of online technology and stuff, but um, we're definitely just craving for the ongoing of work that can be that you can also share with people, you know, who are there, physically there.
One last question for you before we close out the panel. And you mentioned this just now a little bit, but my last question for you is really around how people and attendees can use art to promote social justice for Latinx communities and specifically for children and youth.
Yeah, well, like for me, that art making has been a way to channel, you know, things that I've gone through. So definitely just kind of exploring your identity through art is a good tool that you have. Just I think the trick is just to stick with it, explore it, and not to limit yourself, and kind of think about, you know, the richness of what your experiences have, like the background of your experiences as a Latino, Latinx community member. So just kind of really exploring and knowing, you know, your background, and trying to use different ways to kind of you know, show others or yourself what it means. You know, there's poetry, painting, sculpture, just video, many things that are at your reach for you to kind of tell your story, and you know, just play out your own narrative of what you experience.
Well, thank you so much, Christian. And I want to lift up actually a comment that came in for you, specifically expressing gratitude to you for your art and the needed representation of seeing those narratives depicted in your work.
Thank you.
Yes, that was from Monica. So thank you so much for joining us today. Thank you so much for the art that you create and all the work that you do. We're so appreciative of it and really appreciate you for joining us. Thank you so much.
Thank you so much, and thank you for the space, the time, and for listening. And I know it's like a lot to talk about, but I appreciate the space. Thank you very much, and thank you for everything, everybody who joined.
Thank you. Okay. At this point, we are going to move to our regional snapshot panels. Again, thank you, Christian, for your presentation. That was so powerful. I'd like to invite our health panelists to turn on their camera as I introduce the panel and introduce them. So again, we're kicking off our panels focused on health. Everybody should have a fair and just opportunity to be as healthy as possible, but obviously what we've seen from the pandemic is that is not true. We know that COVID-19 has devastated the health of Latinx communities across the United States, including children. As the coronavirus has really reinforced, unequal life conditions significantly shape a child and their family's health and life trajectory. Today, we will hear from 3 different speakers about the work that they are doing in California, Utah, and Texas to help protect and promote the health of Latinx children and their families. So again, please turn on your cameras in case you haven't already. I'll introduce you quickly. First, I'd like to introduce Dr. Karla Fredericks, who is an assistant professor of pediatrics at Baylor College of Medicine and is the director of the program for immigrant and refugee child health at Texas Children's Hospital. In addition to directing this program, Dr. Fredricks sees patients on the Texas Children's Hospital mobile clinic for under-resourced children and is one of the faculty advisors for the student-run Baylor College of Medicine Human Rights and Asylum Clinic. I'd also like to introduce Mar Velez, who is State Policy Senior Manager at the Latino Coalition for a Healthy California. In her role, Mar leads LCHC's policy agenda to address the social determinants of health ensure healthcare access for California's Latinx and vulnerable populations, and incorporate community voice in all policy initiatives. Previously, she was a congressional aide to Congresswoman Barbara Lee, where she oversaw the criminal justice, Latinx, and women's rights district issues portfolio. Finally, I'd like to introduce Syriac Alvarez-Bayer, who is the senior policy analyst at Voices for Utah Children. She combines her personal and professional experience to build bridges in policy and organizing by centering the leadership of impacted communities and building coalitions to create change. She is a proud immigrant and DACA recipient herself, born in Cuernavaca, Morelos, Mexico, and has called Salt Lake City home for the last 20 years. All right, we will start with each panelist providing an overview of their work and the issues and opportunities impacting the health of Latinx children in their states. Ciriac, can we start with you?
Sure thing. Thank you so much, Gabriella, for letting me be on this panel. It's so great to be on this panel alongside some really awesome folks. And yeah, like she said, my name is Ciriac, and I work on our healthcare and immigrant family policies, and I'm just really excited for this discussion. And I'll begin by first giving like an overview of Latinx families here in our state of Utah, and then a little bit about the work that I do. So Utah has a young population and an even younger Latinx population. Our Latinx families make up approximately 14.4 or 462,000 people. And of those people who are younger than 18, we have an 18% population. So a higher percentage of young people who are Latinx compared to adults. During the pandemic, like Gabriella mentioned earlier, we saw a large number of disparities exacerbated because of the pandemic. At the beginning of the pandemic last spring, we saw huge disparities in testing and cases, where we saw Latinx people make up 37% of the cases, while again, only making up 14% of the population. I know we saw this nationwide, but I think seeing it in Utah, it gave us a unique opportunity to really start looking at issues when it came to racial and ethnic disparities that we hadn't really, that the state really hadn't focused on in the past. And with this, there was able to be made a multicultural advisory committee, a work group for the COVID-19 pandemic, one work group that I was able to be a part of and able to directly make policy impacts on families, including Latinx families. So it again gave us a unique opportunity to work on issues that some people weren't able to see in the past, unfortunately. And yeah, when we look at Latinx families and look at immigrant families, we see that approximately 1/3 of Latinx families come from immigrant families. So we think it's really important to look at policies that impact immigrant families. We see that 53% of Latinx families here in our state are living below the 200% poverty level. And again, sorry, I'm looking at my notes. While looking at health and the state of health of Utahns, of Latinx Utahns, I think it's important to consider other factors, right? The social determinants of health that often affect someone's ability to be healthy. When we look at education rates for Latinx people, for Latinx adults, we see that more than 30%, more than 33% have less than a high school diploma, and only approximately 11% of Latinos have, or Latinxes have, more than a high school, more than a college degree or higher, compared to 30% of all Utahns. Approximately only one fourth of Latinx Utahns speak English only. The majority actually speak English and Spanish, 3/4, and approximately 12% don't speak English well. And when we look at uninsured rates for Latinx people, we see that we have a higher rate of uninsured Latinxes at 28% compared to 11%. And as a children's organization, we focus a lot on access to healthcare. And we know that we have one of the highest rates of uninsured children in the country and one of the highest rates of uninsured Latinx children in the country. So while we have 8% of all Utah kids who are uninsured, it's approximately 19% of Latinx children. So there's a lot to do when it comes to access to healthcare and health in general, where we have a higher rate of teen birth rates for Latinos, for Latinxes, higher infant mortality rates, and higher rates of Latinxes not being able to see the doctor because of cost. And when in the work that I do, I focus a lot on access to healthcare. We have a campaign to try to cover all kids through different policies. And we're also working on a number of immigrant family issues to ensure that, again, Latinx and immigrant families have opportunities beyond access to healthcare, like access to language access opportunities, a policy that we were able to work on last legislative session. And we're successful in removing the English only state law. While we have an English designation, we no longer have that prohibitive law that didn't allow for state funds to give access to language here in our state. We continue to work on policies that affect access to CHIP and Medicaid, especially when it comes to outreach and enrollment, because we know that's really important. And again, we have such a high rate of uninsured Latino, Latinx children that we think it's a really important policy to work on. And yeah, I think I will stop there just to give time to the other folks. But again, thank you so much for letting me be a part of this panel, and I'm excited for the rest of the discussion.
Thank you so much, Ciriac. Mar, if we can turn to you.
Absolutely. Thank you so much for having me. Mar Velez with the Latino Coalition for a Healthy California, State Policy Senior Manager. It's great to hear all the great work that's happening in Utah. We're definitely trying to do our part here in California. I think this last year was a bit of a surprise in California. I think at the beginning of the legislative session, we didn't exactly know, where we were going to be economically given the pandemic. And of course, we know that, whenever the state is not doing so well economically, that burden tends to fall on our most vulnerable populations, including Latinos and specifically Latinx children. But I'm happy to say that we were actually in a great economic position. In fact, we had a budget surplus in California that allowed us to actually get some wins for our children. So I'll get into that in a minute, but just a little bit about LCHC. We are a advocacy organization, statewide advocacy organization. We mostly focus on policy, but we also have a programs department. In terms of policy, we do sponsor statewide legislation. We have also been able to do some federal work, but really focusing on California legislation. And this past legislative cycle, we supported health for all seniors. So we were able to actually get a win for our older adults. We now can say that if you're 50 years or older, and despite documentation status, you will be able to access Medi-Cal in the state of California. So that's a huge win, and that really complements the 2018 work that we did for health for all young kids and young adults, right? Where anyone 24 years or younger actually can now access. Starting in 2020, they were now able to access Medi-Cal. So that was great. We also worked on food for all. Where we eliminated, immigration status as a barrier to access CalFresh, which is basically the statewide SNAP program. And there were other policies such as the AB 1038 is the bill number, but the California Health Equity Fund, where we were really trying to work on upstream factors that impact the health of Latinos and very vulnerable populations in California. So a lot of good work this past year. And in terms of the program side, LCHC also has a network of promotores who do a lot of the work on the ground to inform our communities about, the most up-to-date sort of policies, whether it be through the child tax credit, whether it be vaccination information, right? Our promotoras are really the trusted messengers on the ground that are really getting that really important information to our communities. So that's a little bit about LCHC. And as I mentioned, some of the policies that we worked on, if we focus more on sort of the wins for children, Latinx children in California, Latinx children do make up more than half of the population in California schools, right? So we're 55% of the student population. And there were some critical investments in California around mental health and behavioral health services. So $1.2 billion from the general fund are actually going to be allocated into a Medi-Cal managed care plan incentive program within the Department of Healthcare Services. And part of that money is going to actually facilitate and plan a county and school partnership all across California to increase the number of students receiving behavioral health services. So that's absolutely important given just the strain on mental health for children, particularly Latinx children. We know that based on the listening sessions that we've had with our community members and with our promotoras, we know that Latinx children are experiencing difficulties learning, and part of that is because they just don't have that outlet, right? And so really providing this kind of investment for behavioral mental health within schools is going to positively impact our Latino children. So that's great. Another challenge that we actually heard from our listening sessions with our promotoras was access to food, right? Fortunately, in California, a lot of school districts were able to provide actually meals at home, right? So actually getting the meals from the school to actually get delivered home. And that was positive. We actually, this year and this last legislative cycle, we were able to win universal school meals for children. So, right, so knowing that we make up more than half of the population in California schools, we now are able to offer every single child in California schools meals. That's breakfast and lunch. And so we know that hunger is definitely an issue within the Latino community, not just access to food, right, but access to nutritious and healthy food. And so part of the program is to absolutely provide nutritious meals for kids in our schools in California. So that will be $54 million in the 21-22 budget, $650 million ongoing. So that's absolutely a win for Latinx children in California. And then in terms of, I think I mentioned earlier, we're still working on the Health for All youth and young adult implementation. I think it's great that we were able to get that back in 2018. What we have heard, though, is that enrollment is not as high as it should be. I think there are a lot of eligible kids and young adults, yet they are not as informed about the fact that they are actually, able to enroll. And so we're still working on that enrollment and outreach work. And we're actually gonna double down on that effort now that we actually won the older adult expansion. So that's a little bit about the work that LCHC is doing, and I will hand it back over to the rest of the speakers. Thank you so much.
Thank you so much, Mar. Dr. Fredricks, if you could please provide an overview of your work and the issues and opportunities facing Latinx children in Texas on their health.
Sure, thank you so much for the opportunity. I am actually going to share my screen. Okay, here we go. All right, so just to give us a foundation, how many Latinx children live in Texas? Well, in this data, the counted children is up to 20 years old. And you can see that in the darker green, almost 50% of children in Texas are Latinx. And some of the data that I will show use Hispanic or Latino or Latinx interchangeably. So I'll try to always use Latinx. And how does that translate into an actual number? We know that Texas is a huge state and has a lot of people in it. So how many kids are we actually talking about? Over 4 million. There are lots and lots of Latinx kids in Texas. And so I'm just going to give you a brief snapshot about what is going on with their health. This is data from Texas Kids Count. This came out just this past spring in March of 2021. So if you look at the top, you can see that Latinx children have a higher rate of being uninsured than any other group represented here. You can see that it is nearly double some of the other groups. Then if you look at the green, you see that approximately 50% of Latinx kids are insured through public health insurance, like Medicaid or the Children's Health Insurance Program, which is important because over the last couple of years, we have seen a decline in Latinx children being enrolled in public benefits, including Medicaid and CHIP, as well as other programs such as Women, Infants, and Children and SNAP, the Supplemental Nutrition Assistance Program, which is generally attributed to fear that came up with the implemented but now rescinded new public charge rule, as well as some immigration policies. Overall, 12.7% of children in Texas are uninsured, but it's nearly 18% of Latinx children. And because Texas is so big, if you think about all of the uninsured Latinx children in the entire country, over a third of them live in Texas. So as I think I've painted here, this picture, we have a large problem. Why? Why is health insurance so important? Well, if you have health insurance versus not having health insurance, you have approved attendance at preventive visits, like routine well-child checkups that make sure that the child stays healthy. They screen for asymptomatic conditions, as well as provide anticipatory guidance for the families. Kids who have insurance graduate from high school more often than kids who don't have insurance, as well as from college. And with that education, leads them to attain better jobs and increase lifetime earning potential, giving them a better quality of life, as well as the next generation and the generations to come. Also, when you think about the burden of medical expenses for someone who is uninsured, if you're not having to pay out of pocket for medications or visits to the doctor, then you have more money to spend on things like food and housing, which are, as you know, social determinants of health. And so you're affecting health in other ways by taking away that burden of medical expenses. Let's talk a little bit about those other social determinants of health. So what did this report find? Well, prior to the pandemic, what you can see is that a significant number, around 17% of Latinx households were food insecure. So that was more than the general population, but less than Black households. What happened during the pandemic? Well, as you know, many children became more food insecure. But how did that specifically affect Latinx families? Well, in Texas, the household food insecurity increased from about 17% to 20%. And we saw increases across the board in Black households as well as non-Hispanic white households. Housing instability. There have been some eviction moratoria to prevent people losing their housing, which we know is a very traumatic event in the life of a child and the life of a family. And if you look at this data from 2020, this is again specific to Texas, you can see adults reported, adults who live with children, that nearly a third of Latinx families said they had little or no confidence in their ability to pay next month's rent. So let's let that sink in a little bit, about a third having this concern that they might not be able to pay rent the next month. So how does this affect Latinx children? And what does our program do to try to help that? So when you think about all of these different concerns, they just build up to something that we would call toxic stress, where kids who are constantly experiencing adverse childhood events are bathed in cortisol. That changes their brain structure as they are developing at a critical time. And it increases their risk of problems later in life, as well as, of course, mental health concerns in the moment. So some of the increased risk for adulthood would be, or young adulthood, substance abuse, mental health concerns, chronic diseases like heart disease, and also some types of cancer are actually increased when a person has more adverse childhood experiences. In Texas, 1 in 4 children have a non-citizen parent. So not all of them are Latinx, but a fair number of them are. Many of them are. And not all of them have an undocumented parent. You know, they may have a parent, excuse me, who has a green card and is not a citizen, but many of them have undocumented parents, and that increases their fear. And what we've found over the last several years is that these kids have a constant fear that they're going to come home from school and their parent will not be there anymore because they will have been apprehended and then they'll be deported. And so having that constant fear, again, adds to this toxic stress that children in Texas and across the country, Latinx children are experiencing. SB 4 stands for State Bill 4. That's a Texas specific bill that forces or requires local law enforcement to work with immigration enforcement. So this increases the fear in children that, you know, potentially their parent will just be pulled over for a routine traffic violation. It will be discovered that they're undocumented. They'll be taken into custody and deported. The other issue that we have in Texas that may be different than some other states is that we have very low approval rates for asylum seekers. So if you look at the country as a whole, 30% of asylum cases were approved over the last couple of years. It's less than 10% in Texas. And so we have a lot of people who are seeking safe haven. They're seeking to go through the asylum process and appear in court and prove their case, but most of them are losing and they're becoming undocumented or they're being deported. And so in this situation, let me just stop sharing my screen. We have a program for immigrant and refugee child health that has 5 foci. First is improving access to care. The second is once somebody does access care, what are the quality of services they're receiving? And in order to make sure that that's the highest quality, we have a lot of educational programs geared towards health professionals as well as learners. We also focus on building community collaborations. As you heard from my bio, I am based in an academic institution, Baylor College of Medicine. So we don't want to be siloed. We want to work with community organizations, and we have gotten involved in consortia across the state, the country, as well as locally. In addition, we do a little bit of research, which is mainly to inform our other programs. And through this combination of these 5 foci, our goal is really to improve access to care and the quality of the care for all immigrant children. But in our state, as you can see by the numbers, that our main focus is on Latinx children.
Thank you so much, Dr. Fredricks, and thank you also to Mar and Ciriac. Right now, I'd like to ask all of you a couple of questions, including some that came up through the Q&A as you all were speaking. So the first I have is around upstream factors that you all have mentioned in your opening remarks around the conditions that shape child health and well-being. You all mentioned things like food and housing and security and language access. Why do we see disparities in those social determinants of health for Latinx families? And what kinds of policies or programs can help improve the conditions that Latinx children grow up and develop in order to support and improve the health of themselves and the health of their families? I will pose this first to Ciriac.
Thank you, Gabriela. Yeah, I think we see these issues for a number of reasons. I think, like I mentioned at the beginning, about 53% of Latinx families in our state live below the 200% poverty level, which is the level where a lot of the all the social programs here in our state are done. So we know that it's important that while they face, right, like all of these disparities, that they have access to the social programs that are available to them. But we've seen that a number of families are unable to access the information, aren't able to access the programs because of outreach and enrollment. While it's a lot easier for families on the Wasatch Front, where the majority of our population lives, we know that a number of our population lives in rural counties where they don't have that same access, they don't have that same language access. Like I mentioned at the beginning, here in Utah, we actually had a huge disparity when it came to language access. We had a law, an English only law, that is now an English only designation. So the law did not allow any state funds to be used for translations. And it was a huge issue, especially at the beginning of the pandemic, where not even the executive orders were translated because of the funding structure. And it was so much so of an issue that our governor had to use his executive powers to allow for translations. And from then on, we saw that a number of we had to have a number of interpretations and translations allowed during the whole pandemic. And we know that at the beginning, it was just so difficult for families to even access any information about what was happening. And we know that this was, true, right, even before the pandemic, because the pandemic, again, just exacerbated this issue. And when it comes to food security, we know that there are a number of families, again, who cannot access food security. During the pandemic, we saw that while food banks were accessed, we saw that a number of them weren't even culturally relevant foods for families. So even though they were able to access these food banks, they actually weren't able to access the food because it wasn't food that was actually staples of these families, whether they were Latinx families or refugee families. And so we worked on a number of the task force that I mentioned at the beginning actually worked on this specific issue to try to allow not only food banks to be housed in local nonprofits, but for those food banks to be culturally relevant, because it's important not only to give people access to any foods, right, but foods that they'll actually use and are staples in their community. The other thing I wanted to just briefly mention was just access to trusted members in the community. I think that plays a large role. And I know Maud talked about community health workers, which is an issue that I think is super important here in our state, because they allow for families and people in our state to access programs and resources that they may not otherwise know. And so that is an issue that I'm working on to allow for greater recognition of community health workers in our state, granting a certification program here and making sure that as we do these different policies that they are inclusive. For example, we want to make sure that this policy is inclusive of immigrant communities, so there are no barriers to access for whether it's language or whether it's immigration status. So yeah, I'll stop there.
Thank you so much. And continuing on the point you raised at the end around the importance of having trusted members in the community, another question that came through the chat was around outreach strategies and around public charge. And Mara, I would love for you, if you can, to speak more around how public charge impacted specifically Latinx families accessing public benefits in California. And if you can also speak a little bit more about your work around community health workers and how promotoras have really supported combating that chilling effect that was created.
Absolutely. I think California is seen as sort of this outlier, sort of, that beacon of progress. And I think as much as we tried to sort of, really insulate sort of ourselves from all of that messaging of hatred and xenophobia, it still penetrated, right, our communities, unfortunately. And I think that public charge as a fear tactic, it just really, swept our communities, unfortunately. And so although we have seen a lot of progress on the policy end of things, where we've actually, been able to accomplish and get some wins for our community, that actually, opens up the doors of access to Medi-Cal or even food programs. that chilling effect of that rhetoric is still very much felt. And so you absolutely need, and we absolutely saw the critical role of health workers, during this time, as we were combating sort of these messages. And then even now afterwards, right? I think there are still a lot of questions around public charge on whether or not, if you access certain kinds of services, will that actually count against you? And so I think community health workers, promotoras, promotores, because they come from these communities and because they are so well connected to organizations like ours, actual, legislators, they're oftentimes in the room when a lot of these decisions are made. They actually have that information front and center with them, and they're seen as actual, just outlets of trusted, reliable, and up-to-date information. So I think it's an absolutely incredible method and way of really getting to our most vulnerable populations. I think we need to recognize this sector, this workforce, as part of our ecosystem, right, of advocacy and of reliable messengers. So absolutely critical.
And Dr. Fredricks, moving to you, you also mentioned outreach and education as one of your primary focuses in your work. Can you speak more to some of the education and outreach strategies that you all have utilized to really connect families to health insurance and also other public benefits that they should be able to access?
Sure. So we as pediatricians have made our focus on health professionals. And so while other organizations might be targeting the community themselves, our main focus has been to make sure that health professionals have the right information when they are seeing patients. And so some of the things that we have done, number one, we put together a low-cost clinic list, because there are a lot of people who feel that because they are undocumented or uninsured, that they just won't be able to access healthcare other than the emergency room. And so we want to dispel that myth and make sure that everybody knows you can have a medical home, a place where you go for your checkups as well as sick visits, regardless of immigration status, regardless of insurance status. We also give talks throughout the Houston area and nationally and internationally on the best practices in caring for immigrant children. And part of that is making sure that you are checking their insurance status and not prescribing a medication and saying follow up with a subspecialist, which that family will not be able to do because they can't afford that that medication, and they cannot access a subspecialist because they don't have the ability to pay. So looking at that, knowing your resources where you can get charity care and assistance with medications, as well as recognizing that these kids don't get health in a vacuum. So it's important for you to be asking the questions about where was the child born, so that you're going to know whether or not they were foreign born. We're not asking you to put immigration status in the medical record. In fact, we are very much encouraging people not to do that because it can be harmful. But asking that question because you need to know whether they need certain lab screening, asking about housing, asking about food insecurity, asking about these other social determinants of health, and then knowing where to refer. So if you ask the question, you need to be able to help them. And so equipping our colleagues with an immigrant rights hotline that they can have families call if they're looking for legal advice. We're not lawyers. We cannot tell you that it's safe for you to apply for certain benefits. We can't give you that kind of personal advice, but we can refer you to people who can. And I just wanted to touch on the fact that one of the questions is about how to improve the communication and convince people really that it's safe to do certain things, to apply for certain benefits. And I really think it's that rapport. So whether it be through promotoras who are in the community and they have a rapport with people, but also health professionals, people's doctors, especially their kids' doctor. If you look at surveys, people trust their kids' doctor, pediatricians, very much. And so you already have that rapport, you're seeing the child regularly. And so it is also within our role to help our families in that way as well.
Thank you so much. And I think we only have time for one more question that I would love all three of you to answer. And this is really on the topic of mental health and the importance of addressing and supporting the mental health of Latinx children and youth. We've seen a lot of alarming data recently, specifically with Latina youth across the United States facing disproportionate rates of depression and suicidal ideation. I would love to know more about recommendations that you all have to support the mental health of Latinx children in your states, and any recommendations that you can give to attendees as well. Ciriac, if we can start with you.
Yeah, thank you, Gabriella. I think it's very important indeed. One of the recommendations that we have when we looked at the mental health of immigrant families is access to healthcare. Like I mentioned before, Utah has one of the highest rates of uninsured children in the country. So we know a lot of kids and families are going without access to care, access to physical care or mental care, mental health care. And a large number of Latinx families, 19% of Latinx children are without health insurance. So one of the policies that I work on is to cover all children, regardless of immigration status. We actually were able to create and push for a legislation last session during the January through March months here in our state. And it actually got through the Senate floor, which is really exciting for us being a conservative state that we were able to push it that far. And we know that partially it is because of the alarming rates that we have seen, and people are finally paying attention to how important access to healthcare is and how important access to mental health care is. During the same legislative session, we also saw a number of policies that would permit more access to programming within schools to access mental health care. And I think that is a huge piece, because there are a lot of families who are unable to take their children out of school, right, during the day when people can go to the doctors and seek that mental health care. So if kids are able to see a professional in school or during school hours, there are so many more opportunities, especially because it's found that Latinx families feel much safer in schools and in other places. And I think that's because of the, again, rapport and support that families have been able to seek. And for Latinx families, I also think it's important here in our state that we continue to push the stigma of accessing social programs and accessing mental health care. Here in Utah, we know that a number of our kids who aren't accessing health care and aren't accessing health insurance is because there's stigma, they're unable to because of outreach and enrollment. But again, we do see that a large number of them can qualify for things like CHIP and Medicaid, but aren't accessing it. So again, I think access to health insurance here is key, because that I think that's the first step of many that we have to take here in Utah.
Thank you. Mara, let's go to you.
Yeah, absolutely. I think I shared our win a little earlier about the huge investments in mental and behavioral health for young people through school. So I absolutely think that that's an important and great sort of way to access mental health and behavioral health services. I also think that, as we sort of understand just how important, taking care of our mental health is in Latinx families and for Latinx children, I think we are still battling that stigma around, what does it mean, right, to actually go and see a therapist? Kids might be open to it, but I think parents still have sort of, a few reservations around what that means in terms of opening things up in the family, et cetera. And so I think a cultural shift within the Latino community is absolutely important. I think organizations like LCHC, the Children's Partnership could play a huge role in battling that stigma and sort of those cultural barriers that we have. I think young people are accessing mental health or have the desire to do that. And we need to be able to provide that in a culturally competent way as well. I think we need more therapists of color. We need more Latinx therapists that understand those kinds of cultural challenges, right, to actually accessing those services. So I think on the cultural side of things, we still have a lot of work to do.
Thank you. And Dr. Fredericks.
Yes, well, along the same lines of educating health professionals, part of our presentation that we give is to talk about mental health screening and make sure that that is routine and incorporated into every visit for adolescents and older. That is obviously the first step in identifying that there's a problem. And again, that rapport that you have with your patients, they may not disclose things that first time, but as you see them back in different visits, if you continue to do screening, as we do recommend regularly, then at some point they may feel comfortable sharing. In Texas, we have also expanded the school-based services, and I agree that that is a great way for kids to access care. We also have a network where if you are a primary care provider, because there are not enough therapists to go around, there are not enough psychiatrists or psychologists, the primary care provider is managing some of these more simple mental health conditions. When I say simple, and not to say that it's a simple experience for the family, but just more straightforward in terms of treatment. You can call a psychiatrist who will help you co-manage without the child and family having to see somebody else. They can receive that treatment through their primary care provider. And then lastly, locally, we do have an innovative program where we have a mobile clinic for mental health that goes to certain schools in our Houston-based area. And again, provides free services and has bilingual therapists.
Amazing. Well, thank you so much to each of our panelists. Thank you, Dr. Fredericks. Thank you, Mar. Thank you, Ciriac, for being on this panel and sharing all this important and amazing work that you all are doing in each of your states. Really appreciate it. Okay, and next we have our panel focused on education. So I'd like to invite our panelists to turn their videos on as I introduce the panel and them. So nearly 14 million students in our nation's public elementary and secondary school system and nearly 4 million students in our post-secondary education system are Latinx. Latinx students constitute more than 20% of all pre-K students through 12th grade students and nearly 20% of college students. Our collective success is therefore tied to the success of Latinx students. And although there are bright spots, the pandemic has also made clear that Latinx students continue to face systemic barriers that impact their ability to access a high quality education and be successful in school. Today's panel focused on education will explore some of those barriers with recommendations on what to do about it. So I'd like to introduce our panelists now. First, we have Andy Canales, who is the Executive Director, Texas at Latinos for Education. Previously, he worked as a director at various nonprofit organizations serving students and families, and he began his career in education as a teacher in low-income communities in Miami and New York City. Next, I'd like to introduce Ana Graciela Nájera Mendoza, who is a staff attorney of the Education Equity Project at the ACLU Foundation of Southern California, where she advocates to protect the educational rights of California students. Previously, Ana was an associate at a plaintiff-side employment and civil rights firm where she worked on cases involving wage theft, housing discrimination, and employment discrimination. Ana is from Los Angeles, California, and is the daughter of Guatemalan immigrants. As a former community organizer and civil rights litigator, she is committed to working within her communities and with allies to promote racial and social justice. So like we did earlier, we will start with each panelist providing an overview of their work and the issues and opportunities impacting the education of Latinx children in their states. Andy, if we can go ahead and start with you.
Hello, everyone, and good morning. For those of us that are on the Central or Pacific Coast time, first of all, thank you, Gabriella and Children at Risk for hosting this important conversation. My name is Andy Canales. I'm the Executive Director of Latinos for Education here in Texas. And I think for me, whenever I engage in this discussion, either about the state of Latinx children or the work that we're doing at Latinos for Education, I first share where my passion for this work stems from because it shapes so much of what I do and how I go about the work. Both my parents immigrated from El Salvador in the 1980s. They came to Los Angeles, and that's where I grew up in the inner city. I attended some pretty challenging public schools. My dream as a kid became to go to Pepperdine University in Malibu or UCLA in Bel Air, because those are the universities that I used to see while taking the bus with my mom to clean houses during the summer. And unfortunately, that reality seemed like a far-fetched aspiration, but with the combination of some hard work, support from my teachers, and some serendipity along the way as well, I was able to become the first one in my family to attend and graduate from college at my dream school, Pepperdine University. And to this day, I'm the only one in my family that's graduated from college. And so that is why I'm passionate about education, and especially helping those children that are in the shoes I was once in access a high quality education, because education has transformed my life and the quality of life that I'm now able to lead. I lead a nonprofit, as I mentioned, called Latinos for Education. We develop, connect, and place Latino leaders in the education sector because we believe, especially in a place like Houston and like Texas, that the solutions we are developing in the education sector can be even stronger if we have Latino leaders involved. And so we run several programs to that end. And then lastly, I'll just finish by saying that Latino children will shape the future of Texas, the second largest state in the country. Since 2005, there's been an increase of 800,000 Latino students in the state of Texas. And they will have the ability to help shape the future of this state and of the many major urban centers across Texas. And so how they're doing is really important, not just for the Latino community, but for everyone in Texas and for our country. So with that, I'll pass it back to Gabriela or to my other panelists, but thank you for having me.
Thank you so much for being with us today, Andy. Really appreciate you sharing your story, and we're really excited to get into some of the questions to dig deeper into your work a little bit later on. Now I'd like to ask Ana to also provide an overview. And Ana, I think you also have some slides you'd like to share.
Yes, good morning, everyone. I'm Ana Mendoza with the ACLU Foundation of Southern California. I use she, her pronouns, and I'm going to attempt to share my screen. Hopefully you can see this.
We can see it.
Perfect, thank you. So before I delve a little bit into the work that we do, I do want to start just a little bit with history to contextualize where we are. So to understand the challenges that Latinx students face in California public schools today, I think we need to kind of contextualize their experiences as part of a larger system that discriminates against and underinvests in their communities and in their education. So I'm going to take you way back to the 1800s. So here in California, if you actually research our laws on the books, we can find that California law actually sanctioned discrimination, allowed discrimination in schools by actually requiring segregated schools based on one's race or ethnicity. As California's Latinx population boomed in the 1920s, Latinx students, most of whom were Mexican for obvious reasons, they were relegated and segregated into what were called Mexican schools at the time. And then this segregation became mandated by law in 1935. Something that's really interesting about this time that I think still kind of permeates its way into today's society is that during this time in the 1900s, the early 1900s, there was a question about how to racially categorize people of Latinx descent. Are they white? Are they Indian students? And it was really up to the local schools to decide how to categorize children. So it was possible that if you had children with different skin colors within one Latinx family, some of those children could go to the quote unquote white school, and then some of the other children with darker skin tones could go to the quote unquote Mexican school in the neighborhood. It's actually led to some very interesting court cases as well. So that particular experience actually was at the heart of a case called Mendez v. Westminster in Orange County, California. Here, after the Mendez family won their case in the trial court, our state actually took action and decided that it was going to repeal or remove any language in our state laws that allowed for or mandated the segregation of students in public schools. And so while segregation based on race is now explicitly outlawed, right? We still see that laws are passed in California that attack Latino communities or immigrant communities more generally. So you may recall that in the 1990s, there were two propositions, 209 and 227, which were deemed as ways to kind of disempower communities of color, disempower immigrant communities, and really attack the Latino community, including bilingual education here in California. So as our state's populations, kind of Latinx student population has really grown, right, over the last century, right? So we see this boom in the early 1920s, and now we see that in 2021, that Latinx students actually make up half of the California student population. So California public schools serve about 6 million students, and a little over 3 million of those students are actually Latinx students. We don't know, well, I'll get back to that in a minute. We also know that our state has 18.6% English learners. And so of those, 870,000 speak Spanish, at least 4,000 speak Mixteco, and at least 184 speak Zapoteco. These numbers are likely underreported, and so we expect that there are way more English learners who speak languages that come from the geographic area south of the imposed border. And we know, for example, that there's also dozens of other indigenous languages that are spoken in our schools that are probably not reflected in the state's current database and their tracking. And so we also know that Latinx students in our state are diverse. They're racially diverse, so this kind of data isn't really captured or reported. So for example, we know that there are indigenous students from Latin America in our schools. They likely just get categorized as Latinx, not as indigenous. And then they're assumed to speak Spanish, not other forms, not other languages outside of Spanish. Linguistically, right, our students are diverse, and they're also diverse in terms of like migration statuses and immigration statuses. So we have laws that protect students who are part of agricultural family, worker families. We also have students that are here, you know, they're immigrants or refugees or asylees, and that impacts their rights. But we also have laws on the books that say no matter your status, you are protected and you are entitled to free public education in our state. So now while Latinx students in our states aren't relegated into segregated schools, right, we don't allow laws anymore that explicitly treat students differently based on their race. We unfortunately find that schools are able to adopt policies and practices that have a disproportionate impact on students based on their race or their sexual orientation, their disability status, their immigration status. And so we're finding discrimination really cloaked in policies and practices that are supposed to be neutral, but they impact students of color or Latino students in harsher ways when compared to their peers. So one of these issue areas that we work in where we try to address disproportionality is when it comes to school police presence and law enforcement presence generally in schools. So earlier this year, the ACLU affiliates in California released a report examining the impact of school police in schools. And their groundbreaking findings actually report what communities have long known, right? So that school police presence in schools harms children, especially children of color and children with disabilities, and students at the intersection of those identities. So I'm gonna kind of share some of the findings as they relate specifically to Latino students, but I encourage you to check out the report to kind of see what some of the other larger trends are that they found. So in the report, they analyzed 3 data sets, including a federal data set and 1 state data set at least. And so what the report found is that school police disproportionately arrest and cite Black students, Latino boys, and students with disabilities at high rates. So more specifically, for example, Latino boys are 28% of California students, but 44% of student arrests. And Black and Latino boys with disabilities are 5% of California students, but compose 13% of referrals to law enforcement and 15% of school arrests. We also see that Latino students are arrested at 6.9 times rate higher in schools assigned with law enforcement when compared to schools without law enforcement presence, and they're referred to law enforcement at higher rates as well, at almost 4.5 times higher. We're also finding that we have a state law here that requires law enforcement agencies now to report stop data based on a number of kind of personal characteristics like race and ethnicity. And so there we're finding actually that Black and Latino students are more likely to be stopped for suspicion of violating a crime when compared to their peers. This is actually really the first time that this data has been analyzed. So if you have a moment, I would encourage you to read the findings of that particular section as well. So within this context, right, we know that the data really just confirms what communities have long known for a long time, which is that law enforcement presence and surveillance presence in schools really harm children and disproportionately harm students of color and students with disabilities and students at the intersection of those identities. And so for almost a decade, as most folks know, right, the Black Organizing Project has been organizing in Oakland to remove school police and has had a lot of success in that regard. In LA, we've been working and supporting, sometimes even in the background, supporting our partners on the ground to advocate to stop the criminalization of students in schools, whether that's getting rid of truancy, right, citing children for being late to school sometimes, by eliminating mandatory metal detector searches in our schools, implementing positive behavior and intervention support systems, banning pepper spray, and now we're working on eliminating school police as a way to really support students. And this trend is really taking part throughout our state. So up and down our state, we're finding movement on the ground to really remove law enforcement in schools and to invest very limited public school dollars in evidence-based measures to support academic outcomes for children, as well as supporting their social and emotional well-being. In other words, we need to support the whole child, from like their minds to their hearts to their bodies, to make sure that they can achieve academically and get all of the services that they are not only required to get under the law, but also that they deserve to get. So I'll very quickly just give you an overview of how we're doing this advocacy on the ground through the lens of our work with our youth group, the Youth Liberty Squad. We're advocating for police-free schools, mental health supports in schools, arts education, and just students' rights generally. So they've been really active since 2019, kind of here at the local level, at the statewide level, to organize their peers to kind of achieve these changes in policies and practices throughout the state. So they're doing petitions, they're submitting advocacy letters to school districts and to the state. They're administering wellness surveys during the pandemic to assess where their peers are in terms of their mental health. And so from their survey, they surveyed over 1,200 students across California, and it confirmed what was just mentioned in the previous panel, right? Students are facing high levels of stress and trauma and need mental health resources in schools, and we think they need that more than they need policing, right? You know, these are just some examples of student responses that we've pulled from the surveys, but what you'll see is that, you know, some of the top words are that they're bored, they were lonely during the pandemic, they were overwhelmed, they were stressed, they were sad. So there's a lot, and just because students are returning to school and campus doesn't mean that these feelings and emotions and thoughts are magically gone, right? There needs to be a lot of work in schools to address kind of the repercussions of the pandemic that we all went through and are still going through. They're championing these issues on mental health with our governor and our state superintendent of public instruction. They're getting a lot of support from different organizations throughout the state and their peers to actually elevate this issue of student mental health needs and the kind of need for investments. And so, you know, the California Association of School Psychologists has also been a really great partner for us in this work. In addition to kind of the mental health supports, we're also, our youth leaders are also pushing for investment in arts education and school-based mental health as a civil right. So it's kind of our framing that both arts education and mental health supports in schools are both civil rights. And then finally, kind of the other piece, because of course, you know, we're a civil rights, civil liberties organization with a lot of input and guidance from our youth leaders. We've also been doing a lot of work during the COVID-19 pandemic to inform students and their families of their rights to access an education, their rights to still have special education and related services during the pandemic, and even now as we return to school in person. And all of these are issues, of course, that impact our Latin population and student populations in very real and massive ways. And they really do require a lot of policy solutions to make sure that students get the education that they deserve. And if folks want to know a little bit more about our work, here are some links in some of our past reports that you can search for online.
Thank you so much, Anna. And folks actually asked for the information that you're sharing in your deck, if that can be sent out. Also, awesome. Thank you.
Definitely.
And Andy, I'd love for you to turn your camera back on as we go into our Q&A. Wonderful. So Andy, I actually would love to start with you. Can you speak a little bit more about the challenges that Latinx students in Texas are facing and the systemic issues that those challenges are rooted in?
Yeah, for sure. Well, first of all, I really appreciate Anna's presentation and love seeing the history of the systemic oppression. Well, not love, but I appreciate just having that background and history, especially for someone like me who also grew up in California. And I vividly remember my family arguing in the late 90s about that law that was passed, Proposition 227, about bilingual education, because I have one sibling, he's younger, and we both went to the same elementary school. And I learned Spanish and went through bilingual education. And by the time he went to the same elementary school and had the same teachers, that law had passed. So he had a completely different experience. And I reflect on that a lot. And I joke that, you know, that's why my Spanish is better than his, is because, unfortunately, because of that proposition. But here in Texas, we face similar challenges. So first of all, when we look at the end outcome, only about 25% of Latino students are graduating high school, quote, college and career ready. Now, I know there's a lot to unpack there. How is that defined? You know, what are the pathways that individuals can take to lead a fulfilling life? But just using that metric as a sample, only about 1 in 4 Latino students are graduating college ready. Now, when we backtrack about what are some of the challenges or the barriers that kind of help, you know, hold our students back, you know, I would say that then I would flip over all the way to the beginning of the pipeline, starting with access to a quality early childhood education system. So here in Texas, you are not required to go to school until 1st grade. So kindergarten is not even required. So I mentioned that to just kind of paint a picture of the fact that there really isn't a lot of priority, or as much as we'd like to see, on access to a quality early childhood education. Now, I would say that most children probably start going to school at kindergarten, but I have talked to principals before that have had kids walk into their schools for the first time in 1st grade. That is a challenge because research shows that 90% of the brain develops before age 5. Research shows that having access to a quality early childhood education can make a meaningful impact and a difference in a child's life in terms of preparing him or her to be ready for kindergarten and for the rest of elementary school. And we don't have access to universal pre-K, and that is another challenge. And again, I would point to the mentality in our state. Now, we've made some strides, but this in opening up pre-K for more children, but that mentality still persists. To give you an example of that, in 2017, if I'm not mistaken, either 2015 or 2017, there were two state senators on the floor of the Capitol here in Austin, and they were arguing about, allocating more funds to be able to expand pre-K. And one of the state senators against doing that said, I don't understand what's the big deal about pre-K. I didn't go to pre-K and I turned out fine. I'm a state senator. And so that is a reflection of this type of mentality in our state sometimes, that doesn't really value pre-K or early childhood education. And I think that becomes an early barrier for a lot of our students. The next thing that I would point to is obviously when we look at reading rates, that is a huge challenge. So only about 1 in 3 Latino students in 3rd grade are reading on grade level. I think many of us have heard the statistic that that's a challenge because students who are not reading on grade level by 3rd grade are 4 times more likely to drop out of high school. And if they're growing up in poverty, they're 16 times more likely to drop out of high school. And that is just astounding, an astounding statistic for a state like Texas, where over 50% of students are low income. And in our largest school districts, 75 to 80% of students are low income. Now, why are students not reading on grade level? There's a lot of systemic things that build up to that. I mentioned early childhood education. I would also say access to qualified and supported teachers, especially bilingual teachers. We have a shortage of bilingual teachers here in Texas. Now, I'll give you another anecdote about the issue that we're having with teachers. Here in Texas, especially in Houston, where I'm based out of, if you're driving on the highway or the freeway, you will often see a billboard that says, "Want to be a teacher? When can you start?" Now, I want you to imagine any other profession doing that. Want to be a doctor? When can you start? Want to be a lawyer? When can you start? Want to be anything else? When can you start? Like, our standards are for entry are low. Our support for students wanting to even go into the profession are low. The way we treat our teachers is not what it should be, especially when we look at other countries. And so therefore, the teaching profession has a long way to go in terms of making sure that we are recruiting, developing, and retaining highly effective teachers, and who research shows are the most important school-based factor in the child's education. So those are some of the things, but I could go on and on about all the different challenges that our students here in Texas, and I would probably imagine elsewhere in the country, similarly face in their education path.
Thank you, Andy. And Anna, back to you. You mentioned this concept around the whole child. Could you talk a little bit more about what that actually means in policy? What do policy investments around the whole child look like? You mentioned things like investments in the arts. I know we have community schools and mental health on campuses. Could you talk a little bit more about the whole child and policies that support the whole child?
Yeah, so I think, the concept of the whole, it's kind of odd that we even have to say that, right? It's like, think of the student as an entire child, right? Like an entire person, recognize their personhood and treat them with respect and dignity, right? At the core, that's really what that concept is about. And so it's recognizing that, students come to school and we want to nurture their minds, their hearts, their bodies, their learning, their growth. And so we want schools to be safe places where children can make mistakes and be learners and grow from them. And so policy investments to really support the whole child, I think, really have to mirror kind of, what are the ways that we can actually promote children and children's growth in all of these different areas, right? Academically, socially, and emotionally, in terms of their kind of social skills and networking with their peers. And so I think that policy investments have to be directed kind of at three levels, actually. So first, it's the child, right? So investing for us right now, we're as an organization, we're focused on supporting students like mental health and their well-being. So that means one component is removing law enforcement presence from schools, removing surveillance technologies from schools, including surveillance technologies that are being said that it's to monitor mental health, right? We're finding that all these like practices embedded in white supremacy are now being kind of clouded and protected around our own framing, right? Our own civil rights framing. So surveillance technology should not be used to monitor students' mental health. That's just plain and simple. And so the type of investments that we want are like in the people, right? That are shown to actually support students. So that means an investment in counselors and school psychologists and nurses, right? Annie just mentioned teacher shortages. We also have shortages in these other personnel. So we need investments also in kind of the pipeline, right, of the professionals. And then we need training in their kind of their like anti-racism, cultural sensitivity to make sure that our educators are well positioned to support children of all backgrounds and all identities in schools. And then we also need investments in for family engagement to make sure that our parents feel welcomed and supported and are full partners in school communities, to make sure that students can be supported not only in the school context, but that they're fully supported at home and that there's a connection between both spaces to make sure that students are supported in a holistic way, you know, from home, from the moment that they leave the home, their route to school, to the time that they're in school and the moment that they return, and that they're being nurtured, right? As artists, as people, as learners, as academics.
Thank you, Anna. And Andy, back to you. I would love to hear more from you specifically about supporting bilingual and dual immersion programs that also support the whole child, and this concept around children being able to access programs that actually develop their home language and develop their native language as part of their own identity development. Can you talk more about the importance of bilingual and dual immersion programs and really dispelling the myths that I think people still hold about what they are and how they support the education of children?
Well, you know, if we want you know, bilingual children and children who speak a language other than English at home to be successful, we should all be striving, and as a society, to give them access to a dual language program, and one in which they're able to develop mastery in their native tongue, because the research shows that for someone that is growing up learning and being exposed to two different languages is really essential for that child to then be able to transfer and use their native tongue to increase their learning in English or in any other language. There's a lot of research that shows that, and that shows that a path to dual language education, bilingual education, is really impactful. The challenge is the way that we go about implementing it. So, you know, the research shows that actually dual language from the very beginning all the way through high school is the most promising and has the most impact. Now, here in Texas, many of our school districts may offer dual language or some sort of bilingual education, mostly in elementary school, and then we want to be done with that by the time they get to middle school. And so we take bits and pieces of the research and what works, and we just kind of implement it halfway. And I think that is one of the challenges that we have. I think that we just don't really implement the full scale of what the research shows is really effective, because, you know, if we did that, then I think we'd be seeing different results. So I'll point to that, number one. The second thing that I'll point to is that, you know, I've spoken with middle school principals, high school principals, but especially middle school principals, that will tell me, you know, many of the students that are coming into 6th grade, don't really know English, even though they were in a dual language program or they were in a bilingual setting. And I think that that also traces back to our lack of teachers and the teacher shortages that we have, and that there's many cases in which we have bilingual teachers who recently came to this country, and they may be learning English themselves, or the pedagogy in Texas is different perhaps than the pedagogy in other states or in other countries. And so there's also a transition period for our teachers, and especially if they're learning English themselves. And so again, I think that the more we get into the weeds, if we figure out a model to implement, and then obviously teachers are really important, if we can really figure out a better system for how to recruit, develop, retain, and support bilingual teachers, we would really go a long way in making a difference.
Thank you. Pivoting to one of the questions in the Q&A from the audience, what are your respective positions on standardized testing when it comes to the academic nurturing of the whole child? And Anna, we can start with you if you have any thoughts on that one.
Yeah, so this is a very tough question because there's so many different ideas about the role of standardized testing, but I think for us, we really we tried to look at the roots of standardized testing. Where does it come from? What role does it play? So just as an example, right, this isn't a K-12 standardized test, but just the SAT, which a lot of folks are familiar with. We as an organization last year supported a lawsuit to ban the use of the SAT in admissions at the University of California. And, it's called an amicus brief for those of you. It's a friend of the lawyer brief. So we told the court our arguments why we think standardized testing like the SAT has no place in our public school systems, because there really are embedded in eugenics and this idea that people who are of a particular descent in Europe are elite and are better than everyone else. And so if we look at things historically, I think for us, it really does problematize the use of standardized testing in public education.
Thank you, Andy.
That is a great question, like Anna said. So I think it's really important to have a way to measure how kids are performing. And I think actually most people believe that. I think some people believe that a way to do that is through portfolios, a way to do that is through teachers themselves assessing their kids. Some people believe that standardized tests is the best pathway to do that. So I think for me, that's the starting point. Like, I just think it's really important to know how our kids are performing, especially across academic standards. The second thing is that in a state like Texas, where there's 5.3 million students, how do we go about collecting that information on a mass scale? And I think that's unfortunately, where we come into things like standardized testing, because it's a lot of students, and there needs to be a little bit of consistency to be able to assess how kids are performing. But I do acknowledge that there are unintended consequences or to various policies and laws that are passed. And I think that, teaching to the test, I think that creating a school culture that is obsessed with the test is not the best for kids. Now, does that happen sometimes? Probably, because there are unintended consequences with a lot of policies and laws that are passed. But I can tell you from my experience as a former teacher that the more that I grew as a teacher, the less that I taught to the test, because the more confident I became in my knowledge about how I was supposed to teach certain things, the best way to engage students, to authentically learn the content in order to do that. And I think that this is a place where professional development and support go a long way. I remember that, one of the things that I had to teach was about the Silk Road. And maybe in my first year teaching, I used a textbook. By my third and fourth year, I created a silk road outside of my classroom, and kids were able to trade different things, etc. And they were able to travel the classroom hallway and kind of imagine what it was like to travel and exchange goods on the Silk Road. And then they came back to my classroom and we did a written exercise. When I did that type of activity, their scores skyrocketed, but it was because they were authentically able to engage with the learning and do it in a way that was fun for them. And I think that I came across that, but a lot of times teachers don't have the support and professional development to kind of get them to the point where you're not just teaching to the test. So I think that's another challenge. Here in Texas, we have an A through F rating system. Schools are graded on an A through F rating system. And, in Greater Houston, where I'm based out of, about 45% of schools that are majority Latino and low income earned an A or a B in the last set of school ratings, compared to the Rio Grande Valley, which has some of the deepest poverty in the state of Texas, where 80% of schools that are majority Latino and low income earned an A or B. So then that creates a lot of questions in terms of what are they doing? What are the best practices that is maybe leading to outlier performance? What are the economic and sociological factors that are perhaps impacting that performance? What are the community assets, the culture, et cetera? So many different things. So I do think that data also helps us to identify solutions that could then be scaled to improve education for all kids.
Thank you. And one last question for you both. So you both have touched on this around how Latinx children are really not a monolithic group at all. There are very important differences that exist within this group of children. What are those differences that we should keep in mind? And what are your suggestions for advocates and for audience members so that we don't unintentionally treat Latinx children as a monolithic group that face the same issues? And I'll start with you.
No, I hinted at this in my presentation, but Latinx students are diverse racially, linguistically, ethnically, in terms of all of our identities, right? And so I think in terms of what would be helpful for educators to know and policymakers to know is to really just understand and try to figure out who comprises your Latino student population. So like one gap in our state is that we know how many Latinx students are in the state, right? So like 54% of our 6 million students are Latinx. We don't know, we don't have the data on racially what that breaks down as, right? How many of them are indigenous? How many of them are mixed race? How many of them are Black? So when we talk about Black Lives Matter in schools, if we're talking about Black lives universally, that also includes some of our Latino students, right? When we're talking, when it's Indigenous Peoples Day coming up in October, right? That also necessarily includes some of our Latino students. And so I think we compartmentalize our identities in our lives because as humans, categories are helpful in a lot of ways. But sometimes when we're making categories, when we just limit ourselves to those specific categories, it can kind of backfire and kind of hurt the very children that we want to support and help. So I think, collecting data, breaking down data is helpful. Doing surveys. I know one thing that we're working on in supporting our Indigenous communities here in LA locally is that they want to survey their students and their families, like how many of them are identified as Latinx, but how many of them are Indigenous, from where, and what languages do they speak, what Indigenous languages do they speak. And they want to educate their board members, their school board members, their teachers, to make sure that they are reflected in the policies and services that are being offered by the school district. And so I think that we can always do better as humans, and as categories are helpful, but let's try to expand on what those categories are, who's included in them, and let's collect the data to make sure that we can figure things out, so we can figure out how to allocate resources better.
Thank you, and Andy.
Well, I think the way Anna said it was really great in that we're a really diverse community. We are a result in a combination of our Indigenous ancestors, Spain, and we're Afro-Latino as well, right? And so we're all of the above. And I think that what that means is there's a lot of variation in terms of how we look, how we sound, what are the values that we bring to this country, to our classrooms and to our schools. And I think for me as a teacher, it was really important to know where my students were coming from and what are some of the ways in which their culture was similar to where I was coming from and where my parents came from, and what are some of the ways that was different. And I think what this highlights for me is just really understanding what people's values are and what do they want. You know, I think sometimes we assume, for instance, that everyone wants to leave their home and travel across the country and go to college somewhere else, where for many of our families, that's actually not the case. Like, family is really important, and some of the countries that our students come from don't rank as high on individualism as the United States does. And so that is an example of two values that may clash and may come up in conversations or the way that we talk to our students about their future in college and et cetera. And I think that type of understanding, applying that awareness to the way that we go about teaching our children and engaging with them and our families is just really important.
Thank you so much, Andy, and thank you both for being part of this panel. We unfortunately didn't get to some of the questions that showed up in the Q&A. Andy, there's some for you in there, so if you have a moment or two to answer those in the Q&A, that would be wonderful. But for now, we're going to move on to our next panel focused on economic justice. So thank you again, Anna and Andy. And I would like to invite our next panelists to turn on their videos as I introduce the panel and them. So our final regional snapshot panel, again, is focused on economic justice, and Latinx children and their families have been disproportionately impacted by the pandemic-induced economic downturn, including facing higher rates of unemployment, food instability, and housing instability. Due to Latinx workers being overrepresented in industries that have been hit hardest by the pandemic, Latinx communities have faced large losses in employment, and particularly among Latinas in the service industry. The measure of our economy, though, shouldn't only be about what it produces, but also about how it touches human life and whether or not it protects or undermines the dignity of every human being. So now I'd like to introduce our panelists. Sabrina the Santiago is the Policy and Research Director for Golden State Opportunity, a nonprofit dedicated to ending poverty by providing all Californians with the tools to build financial well-being and thrive. As Policy and Research Director, Sabrina leads the organization's federal and state legislative program and ensures the organization's work is informed by trusted research and data. She also works closely with elected officials and partners to promote anti-poverty policies that help low-income communities build and retain financial stability, such as the expanded income tax credit, living wages, public benefits reform, access to credit, and savings programs. Next, I'd like to introduce Matthew Weinstein, who is the State Priorities Partnership Director at Voices for Utah Children, where he conducts analysis and advocacy focused on the state budget from the perspective of what's best for Utah's children. So we'll start with each panelist providing an overview of their work and the issues and opportunities impacting the economic stability of Latinx children in their states. And Matthew, if we can start with you.
Okay, terrific. Thanks very much. It's an honor to be invited to present today. Let me turn on my screen sharing. I have a few slides to share here about the state of Latinx children in Utah. And I want to begin by saying that Utah isn't what you might expect based on the stereotypes of, white male Mormon missionaries in white shirts and ties going door to door. I actually had a conversation earlier this week with a nationally known economist based in Washington saying to me, of course, Utah is one of the whitest states in the nation. Well, not even close, hasn't been for a very long time. And we're actually the 13th most Latinx state. Our population is now 15% Hispanic in the latest census, including 18% of our children. And we're also, of course, a red state, but we're one of the more pro-immigrant and pro-refugee states than a lot of red states. And that is largely thanks to the influence of the Mormon Church, the Church of Jesus Christ of Latter-day Saints, or the LDS Church, as we call it. So in 2002, Utah was one of the first states with in-state tuition for undocumented children who went to high school here. In 2005, one of the first to have a driver's license for undocumented. In 2010, we had the Utah Compact on Immigration, where the governor and legislative leaders, business leaders, nonprofit organizations like ours came together around a pretty reasonable, especially for a red state, set of principles around immigration. During the Trump years, we saw our governor call for sending more refugees to Utah, not something you heard from a lot of red state governors. At the end of last year, we had a new Utah Compact on racial equity, diversity, and inclusion, where again, our governor, our legislative leadership, our business leadership, as well as nonprofits like ours, signed a public statement calling for equity, diversity, and inclusion. Now, there are caveats to this. Utah is, after all, still a red state. We saw a lot of reports during the Trump years of local and state officials cooperating with ICE on sharing data and leading to deportations of undocumented families. So I don't want to give anyone the wrong impression, but at least there do seem to be more possibilities here. Now, in terms of the demographics, Utah has about 500,000 Latinx population, about 15% of our population, about 18% of our children. According to the Migration Policy Institute, about 9% of our state is immigrants, and the majority of those are still non-citizens. And about a third of our immigrants are undocumented, including about 9,000 children with a poverty rate of about 22%. And we do see tremendous disparities in rates. For example, I mean, the good news for Utah is that overall our poverty rate is much lower than the national average, but we have tremendous disparities, these majority minority gaps that you see. For example, the white child poverty rate in Utah is about 6%, but for Hispanic children, 22%. So almost quadruple the rate. Health disparities, my colleague Syriac Alvarez-Bayer discussed these earlier, so I won't dwell on them, but Utah is one of the worst in the nation for that. Educational disparities. Utah, if you're white, you're graduating high school at the same rate as whites nationally. But if you're a member of the Latinx community, you're not only well behind whites in Utah by 11 points, you're also 3 points behind the Hispanic high school graduation rate nationally. So we have tremendous disparities at the affecting our children and their future economic opportunities and their future, the future of our entire economy, obviously. We did a report back in 2017 focused on juvenile justice disparities that have been discussed by some of the other panel members, the school to prison pipeline, and how it disproportionately impacts Latinx youth. And we see that when you look at the post-secondary educational attainment numbers, where the rate, Utah is in orange in this one, and you can see that if you're white in Utah, you have about a 50% chance of having some sort of post-secondary certificate or degree, less than half that if you're Latinx. Hourly wage disparities are about 15%, about $3 an hour. Again, Utah's in orange here. About $20 an hour if you're white, $17 an hour is the Hispanic number. Family structure disparities, where The percentage of children in single-parent families, about 14% among non-Hispanic white children. In Utah, about 35% for Hispanic children. And certainly in terms of pandemic relief, we saw tremendous disparities. We published a report a little over a year ago that added up the cost of excluding undocumented Utahns from state and federal relief, added up to over $154 million when you added up the stimulus payments, the payments for kids, the unemployment benefits, the enhanced unemployment benefits, added up to just a tremendous amount that puts a tremendous burden because, as we know, certainly here in Utah, as was the case nationally, that the Latinx workforce was both more likely to be laid off and to be unemployed, and more likely to be in essential worker positions where they could not work from home and had to actually show up. And my colleague, Syriac Alvarez-Bayer, discussed earlier some of the tremendous pandemic disparities. This also showed up in the pulse data that the census has been collecting during the pandemic, looking at things like hunger and ability to pay rent, and tremendous disparities in that. I just want to mention in closing that we're beginning to look at school lunch data, free and reduced meal eligibility at the elementary school level, to track concentration of poverty and segregation, increasing segregation of minority poverty in Utah, where Utah historically has been able to avoid a lot of the problems that have affected states like Texas and California, of concentration of poverty, segregation of minorities, especially low-income minorities, including the Latinx community. And but Utah is now beginning to repeat that pattern and to see that. And so we're hoping that by highlighting this in the school lunch data, we can begin to sound the alarm and raise public awareness about this going forward, before it gets to the point of being like some of the larger states that have been dealing with that challenge for generations. And I'll conclude there.
Thank you so much, Matthew. And Sabrina, I'd like to pass it to you to provide an overview of your work and also highlight some issues and opportunities impacting the economic stability of Latinx children in California.
Thank you so much for having me. Good afternoon or good morning to everybody, wherever you are in the country. It's a real pleasure to be here with you all. As Gabriella mentioned, my name is Sabrina de Santiago. I'm the Policy Director for Golden State Opportunity. It is a relatively young organization, and I want to start with a little bit of our background before diving into some of the work that we do and how that intersects with the economic stability of Latinos in the state. So we were founded about 5 years ago. The whole reason the GSO was created was to do outreach in underserved communities around low-income tax credits. It began with the California Earned Income Tax Credit, the Cali ITC. It has expanded. We added the Young Child Tax Credit, which is available to children under 6. It's $1,000. Most of that is refundable. There is also the federal credits that we do outreach around, because if folks are eligible for those can mean thousands of dollars for a family. And recently it was also included the Golden State Stimulus. We've been lucky in California that we have, as Matthew was saying, been a leader in inclusivity. So we have expanded our Cali ITC as of 2020 to include ITIN filers. Children with ITINs are also eligible for the Young Child Tax Credit. And ITIN filers were also able to collect the Golden State Stimulus. Now, I want to put a note there that while reaching out to ITIN filers is a really important piece of the work, it does not encompass all of the Latinx community that we serve. There are many folks, for lots of reasons, who do not have ITINs. Sometimes it's distrust of government. Sometimes it is the significant barriers to filing, including about last I heard was about 15-week delay from IRS in processing, the need for certain pieces of documentation that if you are not willing to mail them to the IRS and be without them for several months, which I don't know about you all, but that would put fear in my heart, especially if it had my immigration papers. If I was somebody who had a green card or a different kind of status, especially, but otherwise, private actors like H&R Block or TurboTax charge up to $300 to collect those and be as a certified acceptance agent to be able to process that part of the application on top of the help for processing the rest of the I-10 application. So we're talking about several $100s, which for low-income families, as you all know, is a big challenge. I'll share a little bit about myself too. My parents immigrated to this country in the late 70s, and they're from different parts of Mexico. They met here. Our joke in our family is that we are Mexican components assembled in the United States. But I share that because for those of folks who have grown up in the communities that we serve, especially for people like me who work in low-income communities, when we say things like $300, we know that that is a big deal. $300 is not, oh, I'll let that ride on the credit card maybe. $300 is the difference, is someone's food budget plus. It is, the entire budget for buying the whole children's in a family clothing for the year. And so when we don't include people who don't have ITINs in filing, or we don't make additional work accessible, don't create supports for folks without ITINs to have their ITINs, we're really not doing all of the work, and we're leaving people behind. And especially those who are already left out of so many other government services. So Golden State is working to make that change. We're hoping we were successful this year in getting some funding to do outreach and to fund local organizations who will be helping undocumented be able to file for their ITIN. We were able to work with legislators to educate them about how just saying ITIN doesn't mean that you're doing everything right by the Latinx community, regardless of status. And what we've been focusing on a lot lately has been the child tax credit. You all may have been hearing about that in the news a lot. I'm hoping that you've been hearing a lot about that in the news. It is one of the most significant things that we can do to alleviate poverty amongst Latinx children, amongst all children, but especially for Black and Latinx children. In July, when payments went out, there was a 3% reduction in food insecurity. We know from data from the IRS and a survey that 46% of the folks who received the child credit used it to buy food. So it's buying exactly the basic things that we know families need, and counter to some of those challenging narratives that think that somehow this money is going to folks who don't need it, or to folks who are going to spend it unwisely. And to me, that just says that they either don't have children or don't know anybody who has children, because they know how folks with children or around children are aware of just how expensive everything around children is, from clothes to food to childcare. And I'll share that there was about 35 million families who received the credit for a total of $15 billion. Why do I bring this up though? The current provisions are scheduled to expire at the end of this year. At the end of this year, we will go back to having a child tax credit that is worth $1,000 as opposed to the current $3,000 or $3,600 for children under 6. We will go back to having a one-time lump sum payment instead of the monthly payments that are currently helping families make ends meet day to day without taking on challenging debt that they won't be able to get out of, or bad debt, frankly, right? Debt that is going to carry large interest rates. So I want to, as we get into the discussion, share that there is places for you all to engage here. And if this is going to be work, if the CTC matters to the families that you serve, I hope that you will get engaged in fighting for this policy that, bottom line, puts food in children's mouths. And we need to get people to understand that and to support it, because with that, by giving children, as you've heard throughout this day, by giving children the essentials to a good and quality that reduces trauma. So things like having enough food on the table, their parents being able to pay for rent, and giving perhaps some of their parents the ability to pay for childcare so that they can get into the workforce and change their families' fortunes in that way. We can really make an intergenerational difference in poverty for Latino families and give them this tool to help bring the next generation of children into a much better place than all those that came before. So I hope that you'll engage. And I'll stop there because I'm sure we've got some great questions that I'd love to answer and get involved in.
Thank you so much, Sabrina. And we will definitely come back to a question about how folks can get engaged around the child tax credit. So we'll definitely come back to that. And Matthew, if I can ask you to turn your video on as well so we can dig into some of these questions. So the first one is really around trying to identify some of the root causes that have caused economic instability and poverty disproportionately impacting Latinx children. Could you speak to some of the systemic issues that are sort of the root causes of those issues? In other words, could you talk more about the disparities that impact Latinx children and their future economic opportunities? And Matthew, if we can start with you. You are on mute.
Sorry about that. No, I think it's clear that at the heart of it, if you compare the United States to the other sort of wealthy free market democracies, we are prepared to tolerate a standard of living at the bottom of our economy, a wage level, for example, and level of standard of living that no other country really tolerates. You know, our minimum wage is among the lowest among the wealthy nations, you know, $7.25 an hour, when it should be more than double that, as I think, you know, most of us know. And a number of states obviously are moving in that direction. Certainly California is moving in that direction. And, you know, that sort of setting the floor so low, also in terms of, you know, basic things like paid sick days and paid vacation, health benefits. You know, the challenge of raising the floor in the economy obviously disproportionately will benefit minority communities, the Latinx communities, as well as rural whites and whites in Appalachia. And, you know, it's something that'll make America a more equal place and create a more prosperous future broadly. So, you know, the challenge of that begins at the state level, because the states are where those sorts of changes begin. You know, the Affordable Care Act was based on, you know, the universal health care effort in Massachusetts. And we'll have to pass $15 an hour in more states before we can get it passed at the national level. And here in Utah, that has been a real struggle. You know, Utah tried to create a healthcare exchange that solved a grand total of 1% of the uninsured problem before the Affordable Care Act solved, you know, more like half of it, before the Trump administration began to undermine it. In terms of minimum wage, we're still at $7.25 an hour. So I think that getting at those basic systemic issues, that basic systemic low standard of living that we allow at the bottom of our economy is going to be at the root of getting at these systemic disparities that show up between whites and Latinos and in so many other ways.
And Sabrina, I would love to pose the same question for you to dig deeper into some of those systemic issues existing in California. And also if you could explain what ITIN means.
Oh, sure. ITIN. It is an individual taxpayer identification number. It is an alternative number that the IRS can issue for somebody who does not have a social security number to file their taxes. It's not just for undocumented folks, other folks use them as well, but they have become a very largely used by folks who are undocumented as a way to pay taxes, because as we know, the IRS doesn't care, it just wants your money. I couldn't agree more with Matthew, is that we as a country have absolutely decided that there is a low standard of living that is acceptable. And I think that is rooted in this sort of American cultural myth that merit makes success and that there is equal opportunity. I, for example, I'm from an immigrant family, but saying that we're a country of immigrants doesn't recognize our Black brothers and sisters and our Indigenous brothers and sisters who are not immigrants and did not come to this country. And so we've wrapped up building our economy around this myth that if you just work hard enough, you're going to make it. And if you are poor, it's because you haven't worked hard enough. And having spent 20 years in congressional policymaking, that was always the underlying thing that people wouldn't come out and say in public, but it was there. They're just like, well, shouldn't they just work harder? If we made it, maybe if we made people work more, talking about the work requirements right now for the child tax credit. There is this myth that poverty is deserved. And I think that that is something that we have to change the narrative about, and that we have to really get at people saying, well, if that's what you believe, then you believe it's okay for children not to eat. Like really take it back to what it means. But I think that permeates everything. That's why what people considered unskilled jobs are paid so lowly, and why our minimum wage is so low. California is different. We have very robust minimum wage in the state, and some places like San Francisco, it is upwards of $20. So I think we also have to say that there is dignity in work, and not in the way people have been using that before, but that folks who are working a 40-hour work week deserve to have housing, food, and access to education and healthcare. I mean, that is what we ask of people, right? That they be contributing members of our society, and that one substitute for that, or one metric for that, has been having a job. Okay, fine, but then we should say that a 40-hour job, because in Los Angeles right now, you have to work 2 minimum wage jobs just to pay the rent on a 1-bedroom apartment. You would have to work 80 hours a week. What does that leave you time to raise your children if you have them? What does that leave you time to sleep, to be a member of your community, to be engaged in whatever sort of volunteer and social good activities that you may want to have? So I think that we've got to push back on this myth, and we've all got to do it together, and not just highlight immigrant stories that are about success, but also highlight all of the everyday people who deserve dignity, and frame, even amongst ourselves, I think in the Latino community, we are a contributor to this myth, and that we've got to start working on that.
Thank you, Sabrina. And I'd love to stay on what you mentioned about how this myth that poverty is something that's deserved, and this concept around individual failures versus looking at really the root causes and conditions that are driving these outcomes. And Matthew, do you have any suggestions or recommendations around how to really shift the conversation to focus more on the conditions that are existing that really are driving those outcomes, like the lack of a living wage, for example? How can we shift more to that perspective?
Well, certainly I think sharing the stories of families and of individuals who are impacted by, in a negative way by the status quo is tremendous. I think mobilization and political mobilization of especially immigrant communities as they are becoming citizens and gaining the right to vote, that makes a tremendous difference. We've seen the impact that makes in a state like Georgia, the newest state to be majority minority. Look what a difference that's made. We know that demographics is not destiny, but it is opportunity. Another area that I focus on a lot that I've got to put in a plug for is tax policy. We often don't think of tax policy in terms of having tremendous impacts on disparities, on the basic sort of, racist history of the United States. but it's right in there, right up there with everything else, as far as creating these disparities and creating the white supremacist sort of economy that we've built in this country. And so here in Utah, we're trying to, follow in the footsteps of California and create an earned income tax credit. We're not there yet. And a lot of the opposition has been based on a lot of the sort of biases and ideas that Sabrina talked about, that people have in their minds. But the earned income tax credit originated as a conservative idea, as the conservative alternative to the minimum wage. And so we're trying to take advantage of that. We actually did get it passed. We actually had an earned income tax credit on the books here in Utah for about 45 days before the whole tax package was repealed a year and a half or so ago. So we're making some progress on that. But the other thing that we're struggling with here in Utah is tax cuts. Utah has been a slow motion Kansas. For those that may have followed the Brownback disastrous experiment in Kansas with tax cuts, where they cut their state taxes overnight, almost a decade ago, by 15%. Well, Utah's cut our taxes by 18%, just done it more slowly over the last 25 years. And so we haven't had the capacity to make the investments in closing the disparities in our education system, for example, in having, smaller class sizes, more individual attention, in helping the communities that most need the help, in avoiding the development of segregated concentrations of poverty. So fighting against tax cuts is one of our top priorities here in Utah.
Thank you, Matthew. And staying on tax policy, let's go back to the child tax credit, Sabrina. So obviously California has filled in a lot of gaps at the federal level, but there's a wonderful opportunity right now for us to make permanent the expanded child tax credit, but also re-include immigrant children. Could you talk more about that opportunity at the federal level and how folks can get involved?
Absolutely. Well, yes, we are incredibly excited that the House draft of the reconciliation bill included a restoration of ITIN children's eligibility for the child tax credit. They used to be eligible until the Tax Cuts and Jobs Act under the former administration. And so this is huge. This is significant. This means that if we can keep this provision in there, it will help. I mean, we cut we raised over 50 million folks out of poverty with some of the pandemic aid, and this was a key part of it. So we could continue to see those kinds of increases for people to engage. It really is about communicating with your policymakers in DC on both sides and in both chambers. Everybody across the board needs to hear how important it is to keep the child tax credit as it is, with the monthly payments, with the increased benefits, and with the ITIN eligibility in a final package. It needs to be, I'll tell you that I've been emailing with the staff that I know and reminding them probably more than they'd like to hear from me. But I want to say, as a staffer, folks sometimes think those things don't matter, but they do. You give account to your boss every day of who's called and on what, or how many letters, how many emails have come in. So I'm going to say that this is one of those things where we need to mobilize. We need to get everybody on this call to call in. We need to get all of our professional networks, all of our social and family networks. You all have a voice. This is important to our community. This could be one of those things where we look back 20 years from now, just like we did on some of the immigration reforms and how much that changed the trajectory of Latinos in the United States. And this could be one of those moments. So I hope that you will all engage. If you don't know how, please, my email is sabrina@goldenstateopportunity. I'm sure we'll send it after this. I'm happy to help with everybody. But if you go to congress.gov, they have a number there. You can call and you say where you're from, you give them your address. They will connect you to the right office. And if you want to do email, there's also a little box where you drop in your email and it will tell you and send you right over to your legislator's website, so you can drop them an email as well. Any way you can, please weigh in. I think it's worthwhile to mention, though, that the package also has a couple other things that are incredibly important. As Matthew mentioned, it does include a paid family leave program. So we could start to be on par with other economies of our size and provide people leave to take care of their families and their own health and without risk of losing their jobs. So incredibly important for especially folks in service and retail who do not often have this benefit. There's also an expansion of Medicare with vision, dental, and hearing, so that our seniors can, I don't know about you all, but know how important dental health is and how much it can impact someone's overall health. There are provisions in there to expand childcare, create a real investment in those programs so that there is quality childcare and universal pre-K across the nation. We heard earlier today about kids who have never stepped foot in a classroom before first grade. And that doesn't mean they can't get ahead, but it does mean that they've missed out on some critical learning that we could help make sure everybody has access to. And think about in your communities how having universal pre-K would mean for people's economic status, right? We don't always tie those things. We think someone who can send their child to pre-K for free is going to be somebody who can use that time to also help improve their family's own economic positioning. So it's all a virtuous circle if we can put all the pieces together all at once.
Thank you, Sabrina and Matthew. Staying on this topic, what are your suggestions for how business, labor, various government agencies, churches, and advocates can really work together to overcome the economic injustices facing Latinx children and their families? Do you have any suggestions on how folks can work together to promote policies that really support the economic stability of those children?
Well, actually, we've seen an example of that happening right here in Utah during the pandemic the last year, where, and it's part of, I think, a nationwide pattern that we've seen, where more of the sort of national networks and national funders have been paying attention not just to maybe the traditional states, but to all states, even states like Utah, when it comes to making investments in developing the infrastructure for civic engagement and for building those sorts of coalitions. And so we were delighted here recently when the Center for Community Change began investing in community organizing here in Utah and brought together a coalition called United Today, Stronger Tomorrow, led by religious and business and community and civic leaders, folks from rural areas, really trying to bring everyone together to identify how we can spend the new federal dollars that are coming in the most effective ways, not putting it into tax cuts or into rainy day funds, but putting it into investments that are really what the state needs in reducing disparities. So being able to have that sort of investment from these national sources, even in a state like Utah, to catch up in a lot of ways to the civic infrastructure that exists in states like California, I think is something that'll pay off a lot in the long term. Because, you know, we were talking earlier about structural issues. You know, it's important to be aware that in the course of the last 40 years in this country, we've really done this sort of, massive socioeconomic engineering experiment where we redistributed all the income and wealth upwards. And so now what we're sort of needing to do is undo that upward redistribution that created this top-heavy sort of economy that just doesn't work. You know, we're supposed to be a consumer economy. You can't be an effective consumer economy if people are making $7.25 an hour at the bottom. So, and I think that's a challenge that, you know, starts at the state level and has to be engaged ultimately at the federal level.
Thank you, Sabrina. Same question to you, and this will be our final question, but if you have any final thoughts on how folks can really partner together to address these issues, would love to hear those as well.
Thanks. I think it's about talking about in all the spaces that you're in as a person. Sometimes changing policy at the federal level can feel really, really big. And so I like to always bring it back to the individual. If you are talking about this at work, because maybe you work in an organization that can't support this, but maybe you work somewhere where you think they don't, like, I don't know, maybe you work at Verizon. They have corporate policy, they can support increased wages. So it's about using all the opportunities that you have in different spaces to say what's important to you and to your community. So you can do it at work, you can do it with your family, you can do it in your volunteer or faith life. I will say, faith and business organizations have been some of the most important partners in building bipartisan support for legislation over the last 20 years. And so I think especially in those spaces, if folks see the opportunity, they should take it and they should bring it back to the interests of that organization, make it win-win, right? If you pay folks more, you're going to retain them more, you're going to have better employees who have better efficiencies. We've seen that in academic research. And for faith folks, the argument that the dignity of the individual and supporting your community is important across all faiths. And so I think that if you channel the argument that way, you're really going to help build some ground level support that will trickle up. So that's what I would say. Just share with those folks in the spaces that you sometimes think, why would I talk about this here? Talk about it there. You're going to help us make the change happen.
Thank you so much to you both for being on this panel. It was incredibly informative. Appreciate all the work that you do in your states. And again, thank you so much. With that, we will wrap up our economic justice panel. And we will move to a pre-recorded interview with Congresswoman Veronica Escobar, who represents the 16th Congressional District of Texas.
I hope everyone's having a good day here at the summit. We thought that this would be a little treat to have Congresswoman Veronica Escobar from El Paso to join us. Just a brief discussion. We're talking about Latinx in America, children and families, and we could think of no better congressperson than Congresswoman Escobar to talk a little bit about this. Welcome, Congresswoman, and thanks so much for taking a little time out of your day for this very quick interview.
Oh my gosh, thank you so much for the opportunity. It is such a pleasure to see you again and to be able to have this really important conversation.
Excellent. So the first question I want to ask is, I would say a couple of years ago, I taught a graduate class on leadership, and we were visiting Texas cities. And I remember we were in Dallas, and the graduate students, most of whom were Latino, they said, we're really surprised that as we look across Texas at the leadership, the population predominantly Latino, the leadership not so much. Talk a little bit about that and how Latinos stand in regards to representation, not only in Texas, but in our country.
Well, great question. And I have to tell you, it's something that I hear, unfortunately, too often from young people, young Latinos in my community as well, that they just don't see a reflection of who they are, their values, their lived experiences at the highest levels of government. And frankly, as you mentioned, all across the state as well. When you look at the governor, the lieutenant governor, attorney general, many of these statewide offices are still, it's white men predominantly. There is such a challenge for folks to run for office. And when you think about school boards or city councils, I had the incredible privilege of serving in local government. It is a sacrifice. You have to basically take yourself off of your career ladder to pursue something completely different. So, you have to think about walking away from a retirement, walking away sometimes from healthcare, walking away from stability, security, and advancement. And when you look at many elected leaders, they have the ability to and the freedom and the liberty to serve because they're retired or independently wealthy, or they have passive sources of income. So it's a lot harder for us, for Latino populations to achieve that. It's not impossible. And we have to do a lot more to ensure that we give the space and capacity to grow our leadership, to have a strong leadership pipeline, because those voices matter.
Do you think that's changing, Congresswoman? I mean, we see some change, right? In Houston, we saw a big change in terms of what was represented by a well-intentioned white guy. Now Latinos are being elected. Beto O'Rourke was in your congressional district. Now you are the Congresswoman. So is that changing across the country? It still seems like there's work to be done, though.
There is still work to be done, but I think it's important to recognize what you just mentioned, is that it is changing. And we are seeing some incredible new faces, especially women, run for office and lead with integrity and professionalism. And I attribute that not just to the fact that we have an electorate now that wants diversity, but more than ever, we have really great organizations that are helping candidates. I received a significant amount of help from Emily's List, from Latino Victory, from Bold PAC, which is a political arm of the Congressional Hispanic Caucus. When I ran for Congress, they, those groups and more really are looking to diversify leadership, and they're putting their money where their values are. They're raising money to help candidates so that we have those diverse voices. Women lead very differently than men. We have different sensibilities, and people with different lived experiences bring important priorities to the table that often aren't reflected when you have a monolith of leaders at the top.
I was at an event at Univision, and I was talking to a group of young Latino men, and we were talking about voting. And a couple of them mentioned this idea that's in the community. I'm sure you've heard it, this phrase, they say, si votan, nos votan. If they kick us out, they figure a way to kick us out. And we know that's not a true thing, but this culture of we're afraid to vote because we're afraid that we may be kicked out of the country. Talk about that, and talk about this idea of how we see little representation or less representation of Latinos voting in our country.
I thankfully in my community have not heard the fear of being kicked out, but I have heard embarrassment associated with new voters or voters who were registered but have never voted. So I'll give you an example, and it was an interesting pattern of conversations that I had with mostly young people in their mid-20s. This was during the 2020 election, as I was calling and trying to encourage low propensity voters to come to the polls. And I specifically was targeting people who were registered to vote but hadn't voted in the last 5 to 10 years. Wanted to know, why had they not gone to the ballot box? What information did they need? Wanted to share with them resources about websites, the elections website, et cetera. I had a number of conversations, and this was really fascinating and heartbreaking, with young people in their mid-20s who acknowledged to me that they registered to vote when they were 18, but they didn't know how, and they felt embarrassed to ask. I had several, mostly women admit that to me, who said, and it took prodding, basically. These were long conversations. It was really time intensive. Why haven't you voted? Let's talk about what your values are, what's important to you, what are your hopes, those kinds of conversations. And it was finally at the end of those conversations where they shared, I agree with you, I should vote. I don't even know where to go, and I don't know what to do once I'm inside. And so my heart broke for them, that's what was preventing them from using their voice. And it told me that we need a whole lot more voter education in high schools, because after many of these calls, these young voters were excited to go vote. There were a handful of them who said, I'm going to walk out. I said, look, your early voting location is 2 blocks away or 5 blocks away. It's open till 8 o'clock. You can go now. And so I had several of them say, I'm going to do it, and I'm going to take my mom, or I'm going to take my dad. So it's infectious, right? If you empower people, it can be infectious. And so it really told me we've got a lot of work to do, especially in communities like mine, in making sure we're walking people through the process so they feel confident and excited about it.
One question that I really wanted to ask you, and I know you're enthusiastic about this, is public policy and policies that at the national level. You're a congresswoman, you're there in DC, and when you think about policies that you want to see pass, maybe they won't pass this legislative session, but you know that they need to pass in order to facilitate a better life for Latinx children and families. What are some of the key policies for you that you really want to try pushing forward?
Well, we are actually debating them right now, and we are working to pull them into our reconciliation plan, which is also known as the Build Back Better Act. What we saw coming out, or at the height of COVID, and in the legislation that we passed, both in COVID relief, but also through the American Rescue Plan, was a focus on helping those most in need. And when you think about the American Rescue Plan as an example, the child tax credit was huge. You know, it was a priority for many of us. I have the privilege of being the vice chair, one of the vice chairs on the Democratic Women's Caucus. And the child tax credit expansion and the direct checks have been extraordinary. They have helped not just the child tax credit, but much of the work, much of the resources we provided the American public helped ensure that we weren't spiraling into deeper depths of poverty and food insecurity. So we really, I think, did a very effective job of mitigating serious, detrimental, long-lasting negative impacts. But the pandemic definitely, I think, for those of us who knew it all along, exposed the deficiencies in the way that our economy is set up, and the way that, as an example, healthcare is tied too often to a job. In Texas, we know that only too well. In communities like mine, where a quarter of our population is uninsured, completely, no access to insurance, these were the families and children who were most at risk. When you look at access to education as well, you know, many of our frontline and essential workers, but many of our frontline workers who were workers who had no options, they couldn't work from home because, you know, they were working in grocery stores or out, you know, in agriculture, meat packing, or construction, essential workers who, you know, some of whom might have appreciated access to higher education. We're going to try to tackle that in our Build Back Better Act with universal pre-K for children, with 2 years of free community college education. So healthcare, education, childcare, access to childcare. You know, when you think about the lack of access to childcare for people who just want to go to work, but they want a place where they can trust they can leave their children, where their children will thrive. We deserve a society that wraps its arms around our families and children. And that is especially true for minority communities, and especially true for the Latino community, which has you know, suffered disproportionately during the COVID pandemic. So we are working, you know, you asked me at the top of this question, what are those goals? It's all of those. And I feel very cautiously optimistic, but emphasis on the word optimistic, that we will get that done through the Build Back Better Act this year.
And it's interesting when you look at the evidence, the research, as we so often do at Children at Risk, what's clear is while there's no silver bullet in the fight against poverty, one of the big bullets, if you will, is quality early education. You know, if we get quality early education to families, it's amazing how academically successful the kids can be. And that's the beginning of the road to success right there, that breaking of the cycle of poverty. So two quick questions for you. Who's your best friend in Congress right now? When you go into the chamber, who's your best friend right now?
You know, I am so fortunate to be surrounded by some very loving, caring, compassionate.
Yeah, but just pick one. I just want to hear one name. Though. That's all I want to hear.
That'd probably be Sylvia Garcia, my comadre from Houston.
Yeah.
She's, you know, we have a long history together. We both served in county government together. So we go way, way, way back. So I walked into Congress with her. She and I were both the first two Latinas elected to Congress from Texas. So we just continue to have a bond that grows increasingly deeper over time.
And like you, she's super friendly, right? So that's sort of a nice
She's
little
awesome.
Yeah,
I love her.
All right, and then a final question today. Are we gonna see a Latino-Latina president first or Latino-Latina governor of Texas? Which is gonna come first, do you think?
Oh my gosh. That's a good question. I mean, it would be my hope that both of those would happen sooner rather than later.
That's too political of an answer though, right? So we need to.
I don't know, but I have high hopes that both will happen soon.
Yeah. If you had to pick one, what do you think? You're not going to let me push you on.
Gosh.
It's interesting. Go on.
I do hope that we have a Latino governor or Latina governor very soon, because the state of Texas has a significant border. Mexico is our #1 trading partner for the state of Texas. More than 40% of the population is Latino. I think it would be so fantastic for us to have a dynamic Latina or Latino leading our state and then helping lead the nation. But I'll take either or both.
It's interesting. It seems like the governorship is an easier reach. And then you see some of these elections and you think, no, it's going to happen at the presidential level.
Right. It's just too hard. Yeah.
It should be governor though, right? I mean, that should be the easy step. I remember on the Daily Show, they did an episode from Texas and they talked about Texas turning blue. And at the end they came back, and this is back in Jon Stewart's day. And Jon Stewart said, those poor bastards, they think they're going to turn Democratic. You know, for Texas, it's just.
We are. We're heading that way.
Not as soon as you and I wanted to, though. So,
right.
Anyway, Congresswoman Veronica Escobar from the great city of El Paso, Texas. Thank you very much for all that you do. And thanks for being at our summit here today. We wish you well. Let us know what any of us here at the summit can do for you. And we look forward to seeing great things from you, Congresswoman.
Thank you so much. Really grateful for this opportunity, for all the support. And I look forward to hopefully having continued conversations.
Absolutely. Thank you so much. Back to the conference.
All right, well, with that concludes our summit for today. Thank you so much to our panelists who each spoke on their work across education, economic justice, and health. We hope all of our attendees are inspired to engage in advocacy on behalf of Latinx children and their families on these issue areas. We will definitely be sending out all the materials from today's summit, including the presentations that were used. So stay tuned for those and a recording of the event. Again, thank you so much. Thank you to Children at Risk for hosting this with the Children's Partnership. Have a great rest of your day. Bye, everyone.